Hi, this is Dr. Brian Bird from Allied Physicians in Rehab. Today we're going to show you how to do trigger point work on the hip lateral flexors called the Gluteus Medius or AB Abductor. It does this movement. It stabilizes your hip, your knee, your ankle down when you can't stand square. If you have to do this and you can't stand on one leg and keep your body aligned like this, and that's usually a weakness that can tie into hip and low back issues as well as lower extremity issues. Cheyenne is going to be our model here. We're going to show how to do trigger points here, and then we're going to show on me, I'll show you how you can work with a tennis ball when you don't have somebody working for you or working on you. So you're going to find this muscle. You're going to either use thumbs or an elbow. You're going to get in and push in or knuckle until the person says deep enough. So we go and we push until she says deep enough. Let's imagine we've just worked on her already, so we're not going to do it twice. We hold that pressure. We get a trigger point release. See previous videos on the basics on trigger points. Then we're going to have our bend the knee toward her chest and then raise it up and down, opening and closing it, okay? Getting it to release more. Then we straighten the knee and then take it up and down further. Maybe go further towards the face, further towards back down. Like that way we can go back down. We could also internally and externally rotate the hip. So she turns it in and out and trigger point and open up all of that. Gets pretty intense, but it's a nice release. Okay, thank you. And then we're going to show you how to use a tennis ball, where basically you stick a tennis ball on the same spot, but you're flipped sideways and it's down. If you do it on a padded surface like this, it'll be less pressure, so you might need that at the start. I'm used to doing this on the floor, and it's a little more, well, quite a bit more intense. But you go on like so, bottom leg straight, and you go up and down, forward and backwards, up, in and out. You can roll around on it, backwards and forwards. You can internally and externally rotate your hip. Going slow, changing position, find where it's at. So right there's tighter for me. But all of those movements make a big difference. And once you feel a release in just a handful of seconds on each spot, flip to the other side. All right.